Bye. So good evening and welcome to the Pitt County Board of Health meeting for November. Thank y'all for being here. We have 5 of our 9 members here, so I'm going to declare a quorum so we can conduct business. And the first business item is to call the meeting to order, which we've done. And then the next thing is to ask for public comments. Does anybody have any public comments? We really appreciate everybody being here. Okay. So if not, the next business item is to approve the minutes which were circulated to you. And does anybody have any questions about the minutes? I'm not sure. Are they in our packet here, Lauren? Oh.
Oh, that's for me to sign.
We have them in the email.
Yeah, you received them in the email.
Yes.
If anybody needs to see a copy of it, Dr. Silvernail has a copy. So I trust people have read them. Any corrections or changes or improvements on the minutes? If not, we'll entertain a motion to approve the minutes.
So move.
Second.
So it's been moved and seconded to approve the minutes. Any discussion? All those in favor say aye.
Aye.
Any opposed? All right, Marcia, would you mind giving us our fiscal report?
Sorry, Irma, they were bringing them in your back.
Oh, that's okay. Thanks.
I'll sign those if you want to sign those.
Okay, thanks.
So we are talking about period 4, the end of October. We did not have any budget amendments the month of October that affected the overall budget. We did have a budget amendment for a grant. Our overall total budget, approved budget is $16,503,000. Our year-to-date, as we move across the sheet, the actuals that we have a deficit of $96,123. Munis is closing tomorrow for the month of October, so we do have some deposits that at the time of this report yesterday afternoon, was not captured. The Munis system has moved to a web base, and it's not like a hardcore program on my desktop anymore. So time and items, we are expecting at least around 260 again for state, and with the year-to-date adjusted, we are at a surplus of 131,715. Our grants, and taking consideration of the 2,000 for Vashti, the adolescent pregnancy grant that we received funding from ECU Health Foundation, brings our grant approved total budget to a little over $2 million. Are there any questions?
Any questions for Marcia? And we need to approve that, right?
Yes, sir.
So a motion would be in order to accept and approve the fiscal report.
So move.
And second, please.
Second.
Great, thank you all. It's been moved and seconded to receive and approve the fiscal report. Any discussion? All those in favor say aye.
Aye.
Any opposed? Thanks, Marcia.
You're welcome.
Next item of old business is the ARPA hazard pay. Dr. Silvernail, you were going to give us an update?
Just that we left it in the old business just so it didn't fall off of our radar. Dr. Garrison, there's nothing new to report on it at this time.
Great. Thank you, John. All right, now new business items. The first one is bad debt write-off, and Marcia.
All right, so annually, we write off bad debt. These are accounts that we do not expect to be paid for. We did the work. They are 120 days past due. This is something that most health departments do. This is also part of our accreditation. Once you all approve, it goes to the Board of County Commissioners. We do expect some funding to trickle back in, but these are 120 plus. We have had an issue with Epic with statements, so we're hoping that we will have funding to come in. We can use bad debt set-off, which is through the state, but what we have found that when we built Epic, we did not capture Social Security numbers. So we are having to go back and apply Social Security numbers within Epic. When they built Epic, they were moving away from Social Security numbers in the medical record. It was a medical record number, and we did mainly Medicaid, so we had a Medicaid number. So, but when we do bad debt set-off, it is tied to the Social Security number. So we will have to do some back work to capture some of the funding, and that would be if someone wins the lottery or state taxes. We file that with the state and it trickles in. But that would be anything over $50. And a lot of, by the time Medicaid is applied, there is not balance of $50. I do not capture this. I capture accounts receivable reports every month, and I send this to the county office, and the county office builds this for me. Mr. Chris McDaniel, who is retiring at the end of the year, that really stresses me out, but this is how he captures that number. It looks pretty large, but that is the work that's been done to the community, and we expect to do the work for the underserved.
So is there what's the action we need to take, Marcia?
I just need you to approve writing off the $443,860.13, which is 120 days past due. And that's for a year. So we did this last year at the same time.
So that 443,660 under October 22nd?
Yes, sir.
But that's a cumulative number, though.
That is a cumulative number.
Okay, so it's not for the month of October.
No goodness.
So your recommendation is that we approve, that we recommend to the county commissioners that number be written off?
Correct.
Okay. Any questions for Marcia?
Do you remember what the number was? Sorry, Kelly. Do you remember what the number was last year, Marcia? Because I cannot.
I can tell you. Last year, if you, second page 120, we wrote off 228,320.
So just to clarify, if we had had Social Security numbers, you would have, for anything over $50, you would have asked that any extra taxes, that refund, or if they won the lottery, we would be able to get a part of that.
Correct.
In the past, how much has that come to?
You know, it's been, you can't really track it. So with HIS, that was the old state system, Social Security numbers were already there. And so it would be sent about every quarter. Then we would get, it would be randoms. We could be anywhere from $100 to $800 where someone, it would trickle in. It wouldn't be anything standard that you would know. And sometimes, when people come in, they will pay. I mean, sometimes they will. Sometimes they won't come in for a year or two and say, hey, here's $5. We send out statements, and a lot of times our clients have changed addresses, and so it costs us more to mail and to keep printing off statements. Prior to this past year, we would only send statements every 2 months, but now we're doing it every week. So anytime somebody comes in, they have a statement, they have a balance, it goes out, and Epic generates that after a week. The Social Security number was interesting because I remember when I started 5 years ago, there was a big discussion when they built Epic that, and Dr. Silvernail can chime in, that there was a trend to move away from capturing Social Security numbers in the medical record. And I guess that's what they used to build the system. But when we dug down deeper, we realized we have to have the Social Security number, that's what it's tied to.
Yeah, go ahead, Kelly.
So then my question is there anything we can do so that you can start to capture the
We
Social
have-
Security number? And it may not be a Social Security number field, it might be a user-defined field, but is there some way for us to start doing that?
We have a meeting with Jenny Sugg next week, and she's going to try to help us, what we've asked Epic to do, if there's any way, I'm not even sure if it's going to be allowable, to see if there is a way that we can go in somewhere in the Epic record, if they are already a patient in Epic, and capture that number. I'm not sure if we're going to be able to do that or not, but moving forward, we've already directed people to get those numbers, so we're hoping that will knock down some of this.
And what do you think is the reason behind, I'm going to piggyback on Adam's question, we go from 228 last year to 444 this year?
I think it's sometimes, I think Epic's real, Epic is accurate with some of the billing and invoicing. And as our providers learn more about how to drop charges, sometimes it's the trends of maybe our scheduling within Epic and people being seen. We did have, in February, we had a resignation, a retirement in the billing department. We've also had several. So it ebbs and flows, I believe, to be honest with you. If we go back, I should have done it, the historic, there was one year where it was $12,000. So it's really hard to pinpoint where the numbers are coming from.
So could this reflect our client's ability or inability to pay?
Absolutely,
Okay.
absolutely.
And then what happens, so we'll recommend to the commissioners, and let's say the commissioners take our recommendation to heart and do that. What happens then?
So it goes into accreditation that this happens. So these accounts don't get wiped clean, so they stay in Epic. But it's just every year, it's like a starting point. Hey, we're recognizing we've done this much work without being paid. We've taken care of our clients, we're doing the work, we know we're not gonna get paid. I mean, it's the work we're in, it's the community we serve. But it is part of the accreditation, and all health departments have to do this. So I guess it's just the nature of the beast, I hate to say that, but I know that when we moved to Epic, we could not move the old accounts from HIS into Epic. So we were starting fresh with accounts. And so the funding that came in from bad debt set off was all from HIS. So that kind of mirrored, it runs in the back. And so we go into a database and add those Social Security numbers. And it may be, we may still get a check from HIS. It trickles in. It's a very interesting process.
All right, but we need to do it for accreditation, and it's just part of what we have to do. So a motion would be in order to recommend to the county commission that they write off the 120-plus day bad debt of $443,860.13.
I move that we go ahead and approve writing off the bad debt.
I'm second.
So it's been moved and seconded. Any discussion? All those in favor say aye.
Aye.
Any opposed? Thank you all. All right, so the annual CD report, is Dr. Hardy or? Hey,
I have some of my stellar nurses here to
Super.
present you that information.
thank you all for being here.
Oh, sure. You're fine up here. Good evening. I'm Lee Cutler. I'm the Communicable Disease Supervisor, and this is Kayla Manning. She's the supervisor over the Immunization program. So we're here to present the 2021 Communicable Disease Report. We've tried to add some color to the report, make it a little snazzier for y'all than it has been in the past. And not to read off every slide, but as y'all know, the Communicable Disease Program, we're we're based under the fact that anybody that's doing communicable disease testing, they're obligated to report to us any positive tests for communicable diseases. And then we're also tasked with investigating those and exercising quarantine and isolation authority. Our main objectives for the CD program is to control the transmission of communicable diseases and hopefully detect cases and then monitor the trends of it so that we can identify something before it becomes out of hand. Some of the services that we include are doing the passive and active surveillance for STDs and other communicable diseases, and then trying to establish prompt investigation whenever something is detected. Some of our other services, we do the implementation of control measures, whether it's for HIV, hepatitis B, hepatitis C, things of that nature. We provide post-exposure prophylaxis, provision of health education to the community and to providers in the area. And one of our biggest things that we try to do is to maintain and establish good working relationships with the other entities in the community that provide medical services as well. For the STD program, again, we monitor the STD rates and trends in Pitt County. We'll get into the numbers that we've seen for 2021. We provide, again, confidential, all of our services are confidential, STD exams, the testing, the treatment, counseling for it, some partner notification, and referrals for things that might be needed if somebody might test positive for HIV and needs to be referred to infectious diseases. For 2021, the STD case counts, just as in the past years, the majority of our STD cases are from chlamydia. The second highest is gonorrhea, and then NGU, pelvic inflammatory disease, and syphilis make up the smaller portions of the pie. And again, this is pretty much the same as in the prior years also. Females are the highest percentage at 62%. For race, African American is the highest percentage at 68%, and Caucasian is at 24%, the next highest. And then for ethnicity, non-Latino is the highest at 95%. So you can see here on this graph for chlamydia, again, from 2018 to 2021, 2019 we had some high rates, and then it dipped down in 2020. And pretty much that's been the same for all the STD graphs that you'll see. And again, I think 2020, obviously COVID, there was less access to health care, less access for people to be able to get tested, treated. And so you see the numbers, except for chlamydia, the numbers haven't climbed up, but for the next ones, gonorrhea is high as well, not as high for 2020. I have two 2019s, 880 is 2020 and 866 is 2021. We provide also syphilis and HIV counseling and testing and investigation of people that have violated control measures for public health law. And we also offer HIV and syphilis partner notification services. For our HIV cases, from 2020 to 21, they have increased. And again, I think that's due to ability to get tested. Our AIDS cases, they have increased as well, not as much as the others. And for syphilis, we're seeing a real big increase in syphilis, and that's not just Pitt County. I mean, that's internationally and all over in the United States, but we are seeing a lot of cases of primary, secondary, early, latent, so early cases of syphilis. And again, I think a huge portion of that is the lack of access and the lack of people being able to go out in the community and do partner notifications. Nobody was going out face to face. It was all being done by phone. It's very easy not to answer a phone call when you don't know the number. So people probably weren't able to be notified, and now that allowed cases of syphilis to happen. Also within the communicable disease program are the other communicable diseases such as foodborne, bloodborne, and vector-borne diseases. And for our hepatitis B rates, you can see they've pretty much stayed steady, plus or minus a case for the chronic and acute. And our hepatitis C cases, again, they've somewhat gone down, but I think once we start doing more testing, because we are doing a lot more testing for hepatitis C now on a regular basis for individuals, we may see that go up. And just 2 of our foodborne illnesses, you can see from 2020 to 2021 for Salmonella. Again, those are pretty big increase, as well as for Campylobacter. Those are, and that may have been due to things loosening up in the community, people being able to go out, restaurants opening back up, people having outdoor picnics, that type of thing, and allowing some of these foodborne illnesses to occur. And just for 2021, thank goodness, we had no adult flu deaths and no pediatric flu deaths, but obviously we were very deep into COVID. For tuberculosis, that's one of the other communicable diseases that we're following. Again, that tends to be making an increase also internationally, TB cases. So we want to reduce the number of new cases of TB and make sure that we get everyone taken care of for that to control the spread of it. Again, this is just like other CDs through surveillance. We do direct observed therapy for active TB cases, treatment of contacts if need be, and then if need be, isolation measures for tuberculosis cases if they're not following control measures. And just for TB and latent TB cases in 2021, we had 28 latent TB cases. So they're not infectious, but they have they've been exposed to TB and are positive now at some point, but they're not infectious. We had 5 brand-new TB cases for 2021, and then the total number that we ended up working was 6, because one of them was a carryover from 2020 into 21 for the treatment. And just ever since COVID has happened, there's still a national shortage of the TB and latent TB medications. That's mainly due to the manufacturing and the shortage of some of the pharmaceutical ingredients to produce the medication. So we're tasked with prioritizing who gets the medication. Obviously, somebody who has active TB, they're going to be the highest priority so that it won't spread in the community. And then, just so y'all know as well, these cases are followed anywhere from 6 to 9 months, and it could go out to 12 months, depending on the situation of that person. So it's a very time-intensive process. A long process of following these individuals, and a lot of medication. And then Kayla's going to go over the immunization stuff.
Hey, how are y'all?
Good, thank you.
Good. Like she was saying, I'm the immunization and child health supervisor. So, of course, with immunizations, one of the main goals of immunizations is to prevent vaccine-preventable diseases here in North Carolina. And then if those are identified, we manage the outbreaks of those within communicable disease. Follow up at the health department. A big part is providing education to the community, and then this has vaccine cocoon, and that's, of course, like with an infant, that preventing against pertussis. Let's just say, like, everybody around that infant getting immunized to protect that infant. So that's a big project right now with education. We do provide Vaccine for Children program. It's a state program, shortened to VFC. We also provide immunizations to adults. Those costs do vary. We do file insurance that's listed here: Blue Cross Blue Shield, MedCost, Aetna, Medicaid, Medicare, and then we accept, pay out of pocket for vaccines as well. We do offer pre- and post-exposure prophylaxis for rabies, and then the North Carolina Immunization Registry for the school systems, daycares. We offer services with that. With the state, the 2-year-old cohort, so that's children being up to date. We're followed that with the state. The percentage of those children that are up to date by their 24th month of life. Over there on the right, those are the number of doses that that children are required to have. So we followed those. This is our number. We were at 100% of children that are followed by Pitt County Health Department were up to date by their second birthday. So we feel like that's a success. Those are the goals. 2030 goals are 80%, and then the state goals for 2021, 2022 were 90 and 76. So we were above and at the benchmark, so that was a good thing. We also follow children by age 13 that are fully immunized. That's not an actual benchmark with the state, but I'm told that that's coming, possibly down the road. But for us here in Pitt County, that's kind of it's a big deal. So we have, within the last few years, started doing, we've always done immunization back to school clinics, but especially with COVID, started doing the drive-up clinic or drive-through clinics. In 2021, so last year, we saw 292 students during that initiative. So that would have been mainly middle school and high school students. This year, we saw the number was even greater. Sometimes parents are they have a tendency to maybe be a little bit more delinquent until the 30th day of school when they get that, suspension letter in the mail. And so then it's crunch time for us at the health department. So I feel like we've done a good job, especially being short-staffed, of responding to that this year. And then, of course, it goes on to list the flu vaccines. We are doing flu vaccines at the Joy Soup Kitchen this year, hoping to get back out to like Piggly Wiggly, places that we were last year. That's listed on another slide. Oh, here we go. The vaccination clinics in 2021, we gave 2,411 vaccines to children and adults, and then 25 total COVID vaccine clinics were held at those various places. We actually did one with a food drive at Cornerstone on the 22nd of October of this year. So we're continuing some of those. Oh, okay.
And again, just following up on the end of the COVID highlights for 2021, because that's a whole lot of our time and energy went into COVID. We still were a main liaison with Pitt County Schools, helping to troubleshoot the exposures and determining did people need to quarantine or isolate, what needed to be done, and looking up testing information if somebody had tested positive or negative. And again, and we're still liaisons with them, working on, if there's any COVID cases, but now it's more so like with the flu and RSV that we're seeing this year. We're also still, and we were liaisons with the long-term care facilities here, and following the outbreaks that happened with those with COVID. Again, that's a very time-consuming and lengthy process of following up on the long-term care facility outbreaks, whether it's COVID or flu. But for 2021, it was all mainly COVID outbreaks. And you can see for 2021, Pitt County had 21,850 COVID cases reported. 115 COVID deaths were reported for 2021. And then the number of outbreaks and clusters that we covered were 22 outbreaks and 45 clusters. And just to give you an idea of the length of time that takes, it recently just changed this year, I think in June, to where we only have to follow them for 14 days from the last known positive test, where back in 21, we were having to follow each of these outbreaks or clusters for 28 days. And then if another test came back positive on day 27, it started all over again. So again, that took a lot of time and energy, trying to get in touch with people, trying to find out information about the clientele and what was going on, and if we could help them in any way with infection control. So basically the summary for our communicable disease report, the things that are probably right now that are impacting the effectiveness of our communicable disease control efforts is probably our staffing, because we are so short with our staffing. Kayla and myself are here doing the reports because there are no coordinators. All those positions are vacant. The TB coordinator, the communicable disease coordinator, and the immunization coordinator. So that in turn, we're also doing the work of those programs since they're empty. And anybody else that has communicable disease experience in the building. So again, our other things that we want to try to help do have ease of access to quality health care, the timeliness of it, and again, increase community awareness for things and having community partner collaboration. Our main focus, to hire and retain the staff that we have. When you have staff that leave that know information, then bringing somebody on, it's not an immediate fix. It's a long time for the onboarding and for just to gain the education of what they're doing. And again, this is our communicable disease program staff, myself, Kayla, Renee. We do have one coordinator, Renee. She ran a marathon this weekend, so I think she's home resting. And again, you can see the highlighted ones are the ones that are vacant, and they've been, I know the TB program coordinator's probably been vacant for 4.5, 5 years. And the communicable disease program coordinator is is second longest that's been vacated, and immunization is the most recent one. And we did hire a new disease intervention specialist. They're the ones that work our syphilis and HIV cases. So he just started with us, and he's actually just got released. So hopefully that'll be a help, having him being able to follow these cases. And he can actually help with any of the other communicable diseases as well. So that's a plus for us. Any questions on any of this?
And so, first of all, that's a great report, and it's incredible the work you're doing considering how short your staff is, so you're to be commended for that.
Thank you.
So every day I hear that the Children's Emergency Department at the medical center is setting new records for patients. How is that affecting y'all with the current sort of outbreaks that are going on?
I mean, we've given a lot of flu vaccines. You know how many flu vaccines we've given to individuals? But like, I think a lot of the cases too are with RSV, so we're not, the flu cases aren't reportable to us. The only thing that's reportable is a flu death. So I mean, I see that same as what you see. Now, the school nurses, they are reporting. I just got information today that there are probably what would be considered an outbreak at several of the elementary schools. And I think just from what it looks like in the news, that's going to continue to occur. I mean, you know, when half the class is out. But again, it's very easily spread. So I think we're just waiting to kind of, I think they're familiar with the flu. So, I mean, that's like an old school thing. So they're familiar with the functioning of that and how to handle those things. So it's not like how it was with COVID. So it hasn't affected us a whole bunch, unless you know of something otherwise, Dr. Silvernail.
Not at the health department level.
Right.
No, it hasn't really affected us.
And again, and we don't see, you know, we don't provide acute care for individuals that have the flu or RSV or something like that. So it is mainly the hospital and the urgent care centers that are being inundated.
Great report. And thank y'all for all your work. Any questions? Answers?
Anybody else? Okay.
Thank you. And we need to accept and approve that report.
That's correct.
So a motion would be in order for that.
So move.
Thank you, Brett.
Second.
It's been moved and seconded. Thank you for those motions. Any discussion? All those in favor say aye.
Aye.
Any opposed? Dr. Silvernail, we'll take your report now.
Thank you, ladies. Good evening, folks.
Good evening.
Sometimes I feel like I give the same report every month.
It's the same outline.
Same outline, yeah. So anyways, good to see you all tonight. I want to thank my staff for the CD report. I went begging to Lita. She's like, yeah, I'll be ready. And appreciate the report, ladies. So anyways, let's talk about some outbreaks of concern. COVID, we'll start out with the big one here. We are actually kind of riding a very flat curve at the moment. 1, 2, 3, 4, 5 weeks of relatively flat COVID numbers in the community, and actually a little bit of a downturn on the last one, although some of that may fill in as they collect case data. This is the curve by race. Here's the curve by age. Same curve, again, those same 5 weeks of relatively flat activity. Most of the curve is red. This continues to circulate in sort of the young adult workers, that 25 to 49-year-old age group as the group that is predominantly bearing this, the brunt of this by age. Here's our testing and percent positive. We've actually seen a little uptick in testing the last couple of weeks. Testing is back up somewhat in the county. Our percent positivity is below 10% in that, which generally below 10%, I have felt pretty good about that as a number throughout the pandemic. If we're below 10%, that we're not too bad off from a transmission standpoint. In the regional surveillance that comes out of ECU Health, the regional surveillance is at 5.3%, which I thought was really a good number from a regional perspective. I don't share a lot of ECU Health data, although this is part of Bill Clee's report, the hospital epidemiologist. Hospitalizations finally dropped from last week. We've been riding about 70-ish hospitalizations across the system. Dropped to 51. The numbers kind of overlie each other. There are 6 folks in the ICU. 2/3 of those are 4 are on vents, so a relatively small population in the ICU right now with COVID. In the county vaccinations, not much of a change since last month. 58% of the counties had at least 1 dose. 55% of the counties completed a primary series. And they're not giving me total booster numbers anymore. They're giving me new boosters. You can see booster uptake has been kind of slow. We're only about 5% of the county has had a booster dose with the new bivalent booster that's out. I wanted to show you, I clipped this off the state dashboard this afternoon. This is the state immunization curve or vaccination curve. And you see in 2020 and early 2021 how much vaccine was being given. That was the end of Alpha. And then we have the Delta wave here, which would be sort of the August time frame. And into September. Actually, the height of Delta was around September 11th of 2021. And then after that, a couple of little bumps, but vaccine uptake across the state, this is state data, across the state has fallen off to very minimal levels. Fortunately, or unfortunately, I guess is the right word. Monkeypox, our second federally declared public health emergency. Monkeypox, right now the state stands with 658 cases. We've had 5 cases in Pitt County. Pitt County Health Department remains the monkeypox vaccine hub for eastern North Carolina. Across the state, there's just shy, a little over 23,000 vaccines have been given across the state. We have given in our vaccine program 288 doses of monkeypox vaccine, and we have transferred 182 vials or 910 intradermal doses to other local health departments and community partners across eastern North Carolina. So good work on the part of our immunization folks. Here's the state monkeypox epidemic curve. Again, the last couple of bars may fill in some more. Kind of hard to say. I think a lot of monkeypox has gone undetected. For most people, it's an indolent skin infection with a few lesions. So I think a lot of it has gone undetected, although looking at that curve, you'd say, well, yeah, we're on the backside of the epidemic here. Vaccine's been pushed out since, when did we start? July? Gosh, has it been that longer? So it started in July, pushing vaccine out across the nation. So I think maybe that's taken some bite out of transmission. Also with awareness of this circulating, hopefully people have been a little bit more careful. But obviously they still engage in at-risk behavior. But from that curve, you'd say we're probably on the backside of the monkeypox for now in the state. Other things, and Dr. Garrison, this is what you were talking about. This is out of that ECU Health report. Bill did not put historical data with this, but you can see how fast influenza A has grown. So we're a little early in terms of the amount of the rise in influenza A, but it is flu season. Not that viruses mind the calendar. We think of flu season from October 15th through March 31st. A lot of RSV. But again, this is typical RSV season. The past couple of years, 2020, 2021, COVID has outcompeted and displaced these infections. So we've seen them with altered distribution. We're back to a year where RSV is kind of back on its normal track from a time standpoint. Flu's on its normal track from a time standpoint. So we've seen rises in those. We've seen a fair amount of rhinovirus, enterovirus, some human metapneumovirus, and some parainfluenza virus. Some of that is the amount of sampling that goes on too. We're more inclined, I think, now to do multiplex PCR testing or individual PCR testing for these things. So it's hard to compare these from season to season because we don't measure it across the community. And as Lee said, these aren't influenza, RSV, these infections are not reportable, so tests that are picked up in the hospital lab we have data on, but we don't really know the denominator, what's really out in the community with these. But certainly there's a lot of RSV out there and a lot of flu out there relatively early in the season. So maybe we'll peak before January, the first week of January, like we normally do with these. Public health workforce, wanted to share with you something. This was presented to us at the health directors meeting last month. This is North Carolina Department of Health and Human Services, their Division of Public Health data, and I clipped this graphic out of their presentation. At NCDPH, the North Carolina Division of Public Health, they are currently 23% vacant. We have been running about 22% vacant at Pitt County Health Department. 57% of the folks who left the state health department, the State Division of Public Health, cited pay as a reason for leaving. 14% of DPH staff will be eligible to retire by July of 2014. So that's kind of a scary number too. And they brought up, this is old data from a CDC report about mental health conditions in the public health workforce at all levels. They reminded us that 56% of public health workers report at least one symptom of post-traumatic stress disorder after COVID. This was during the COVID response. So that's what it looks like at the state level. At the health department here in town, we have filled some positions. We've had some others vacated. Staff remain highly stressed from COVID and the response to COVID. Talking with one of my staff members today, you know, no phase of life is normal for anybody anymore. Work isn't normal, home isn't normal, social activities aren't normal. You know, we've just shredded the fabric of society with COVID and the response to COVID, and it's going to take years to put that back together. So I don't know that this gets better anytime soon from that standpoint. Restructure, a couple of updates here for you. The dental division was created with the hiring of Dr. Jilg, or Jilg, it's actually Gilg, it's a German name. Medical records has been moved to personal health. They'll be reporting right now to Dr. Hardy, pending the hiring of a clinical services supervisor. Preparedness, our preparedness coordinator now moves to me. I felt it was important that that individual, that Abigail, have direct line of authority from me to work across the agency on those preparedness initiatives. Human resources, which had previously been part of our administrative division, has been moved to me again. The health director is responsible for the hiring, firing, and discipline of the public health workforce, and I have to work closely with our human resource officer, so I've moved her over as part of my command staff. Care management has temporarily been moved to me in terms of supervision, pending the creation of the care management division. I had to take something off of Dr. Hardy's plate in order to give her medical records too, so it was kind of a swap. We agreed to a swap. Thank you, Kim, on that. A couple of quick highlights for you. There are some highlights for the personal health division in your packet. I had already submitted this presentation before I could receive those. Mentioned Jim Gardner. We told you about Jim. His article's been published in the Biting Times. It's a one-pager that's in your packet, and the full Biting Times was sent to you electronically. So again, congratulations to Jim, our vector control person in environmental health. And then last but not least, Angie Watson from our WIC Nutrition Division received the Diabetes Provider of the Year Award. And if you look close against Angie, it's one of those loose light awards. If you look closely against the backdrop of her shirt, you can see she's holding her award. It's kind of hard to see it. But that was presented to Angie last week by the North Carolina Diabetes Advisory Council. So Angie works very hard with some of our county employees, and then also with folks from the community in our diabetes prevention and control programs. Really does some wonderful work, so we're very proud that Angie's received that award. And that's the end of my report, so questions, comments, further discussion, and as always, we remain in the eye of the storm.
With one coming.
With another one coming, you're right, Dr. Garrison.
Any questions for Dr. Silvernail? All right, great report. We sure appreciate it, and I don't think we need to vote on your report. We'll accept it as information. All
Thank you,
right,
folks.
and any other business for the good of the order? I will tell you that in December, we have a dinner. It's not a meeting per se. Is that right, John?
That's correct. That's always been a social event. So
And-
thank you to you for serving on the board.
Thank you. And at our meeting in January, we're going to do a couple things. One is receive the report on the recommendations of new members, and then we'll also be going into closed session to do Dr. Silvernail's evaluation. So heads up on that. And anything else? If not, we'll entertain a motion to adjourn.
So move.
Second.
It's been moved and seconded to adjourn. If there's no objection, we'll stand adjourned. Thank you.